The topic of discussion is developmental disturbances of teeth part 2, wherein we are going to discuss about developmental disturbances affecting the structure of the teeth as well as the number of the teeth. So going on to the first category, developmental disturbances affecting the number of the teeth, which includes anodontia and supernumerary teeth. First we will see anodontia. Anodontia, broadly it represents congenital absence of teeth. So wherein anodontia there are two types, total anodontia and partial. Wherein total anodontia it represents congenital absence of the teeth, as in this picture where there is complete absence of the teeth. And this total anodontia itself is of three types. That is, first is the true total anodontia, wherein there is congenital absence of the teeth, which is seen in conditions like hereditary ectodermal dysplasia. Whereas false anodontia, which is also called as induced anodontia, which occurs as a result of extraction of all the teeth. Whereas pseudo anodontia, it is because of multiple unerupted teeth. That means, so whenever anyone says anodontia, it should be meaning that it is a true total anodontia. Now going on to the next one, partial anodontia, which is also called hypodontia, wherein it represents the lack of development of one or more teeth. There is a subdivision of this hypodontia called as oligodontia, wherein there is lack of development of 6 or more teeth. So what are the clinical features in hypodontia? Here the most common missing tooth will be third molars, second premolars and laterals, and sometimes this hypodontia is associated with microdontia, which leads to reduced alveolar development, increased freeway space and retained primary teeth. So how does this hypodontia occur? That means what are all the theories behind hypodontia? The main cause is because of the absence of appropriate dental lamina, which can be because of genetic or environmental factors. So some environmental factors include trauma, infection, radiation or any underlying endocrine disturbances. And the genetic factors include the genes which help in tooth development, that is PAX9, MSX1, EBA, AXIN2. Any of the mutations of these genes can result in hypodontia. So this is about anodontia. So next, moving on to the category supernumerary teeth. So which means it is the presence of an additional tooth to the normal set of dentition. It is an additional tooth to the normal set of dentition. So what are all the theories behind the occurrence of supernumerary teeth? It may be because of the development of a third tooth bud arising from the dental lamina of a permanent tooth bud. Or it can be because of a splitting of the permanent bud itself. Or it can be because of hyperactivity of the dental lamina, or maybe because of hereditary tendency. So the most common of the supernumerary teeth is the mesiodens, which is seen in this picture. So this mesiodens, it is present in between the two maxillary central incisors. This is the commonest one, which is followed by distomolars. So these distomolars, they are the maxillary fourth molars. So this radiograph shows two bilateral distomolars on both right and left side here. And the next one is paramolar. This is also one of the supernumerary teeth, which occurs buccal or lingual to the maxillary molars. So this is a paramolar. So these supernumerary teeth, they are seen in some conditions. That is, they are associated with some conditions like cleft lip and palate, cleidocranial dysplasia and Gardner's syndrome. And based upon the morphological types, the supernumerary teeth are of 4 different varieties. That is conical, tuberculate, supplemental and odonto. So see, going on to the conical type, the example is mesiodens, which we have discussed before, which has this converged mesial and distal surfaces representing that conical shape of the tooth. And the next one is tuberculate variety, wherein the supernumerary teeth contains one cusp or tubercle mode, and these teeth are usually barrel shaped, and their location, most common location, is on the palatal aspect of the central incisors. If you see this picture, those are tuberculate variety of supernumerary teeth which are present on the palatal aspect of central incisors. And the next variety is supplemental, which represents the duplication of a teeth in the normal series. So here there are two laterals. So the most common of this is maxillary lateral incisors followed by premolars and molars. And the next variety is odontome. So other than knowing this as supernumerary teeth, it is also a hematoma or an odontogenic tumor. And there are two types of odontomes, which is complex odontome and compound odontome, depending upon the type of tissue present. So these are more like tooth-like structures. So this is about supernumerary tooth. So moving on to the next category, that is developmental disturbances affecting the structure of the teeth. Under this, the first one is amelogenesis imperfecta. It is very important. So amelogenesis imperfecta, it represents the structural defect of a tooth enamel basically, and it has various other names like hereditary enamel dysplasia, hereditary brown enamel, and hereditary brown opalescent teeth. So before going on to discussing about amelogenesis imperfecta, let's see little briefly about development of enamel. And this development of enamel can be studied under three major headings, that is elaboration of organic matrix, followed by mineralization of this matrix, and then maturation of the matrix. So if there is any disturbance in any of these three major stages, it can result in different types of amelogenesis imperfecta, like hypoplastic amelogenesis imperfecta, hypocalcified amelogenesis imperfecta, and hypomaturative amelogenesis imperfecta. So here is a picture showing descriptive diagram about the different types of amelogenesis imperfecta. If you see the first picture, which represents normal enamel, that means it has good amount of organic matrix and good mineralization and maturation. So that's why it has good thickness of enamel and good color of the enamel. So if you see the next different types, that is hypoplastic pitted variety, wherein hypoplastic is nothing but defective organic matrix. So because of the defective organic matrix, you can see pits over there, but whatever organic matrix has deposited has undergone good mineralization and maturation. So that is why the color is retained, but there are pits. If you see the generalized variant, wherein a generalized absence of organic matrix is there, so only thin portion of organic matrix has deposited, which has undergone good mineralization and maturation. Next is hypocalcified. Here where the organic matrix deposition is good, but the mineralization is defective and maturation is also okay, resulting in very soft enamel. Whereas in case of hypomaturation type, here organic matrix is good, mineralization is also good, but there is a defect in the maturation wherein it makes the enamel very brittle, which results in chipping of the enamel surfaces upon biting. So what is the classification of amelogenesis imperfecta, which is given according to Whitcomb in 1989. As we have discussed three types, there is also a fourth type which includes hypomaturation, hypoplastic with taurodontism. And you can see there are various other subtypes under each main heading. So these subtypes are given based upon the inheritance pattern, that is autosomal dominant, autosomal recessive, or X-linked dominant. So now going on to discussing about clinical and radiographic features of different types of amelogenesis imperfecta. First one is hypoplastic amelogenesis imperfecta. Here, as we have discussed before, there is inadequate deposition of enamel matrix. So whatever matrix which is present, it will mineralize appropriately. Good mineralization will be there. So problem will be in the enamel thickness. So whenever there is deficient enamel thickness, it results in open contact points between the teeth. And radiographically, if it is a generalized variant, a thin peripheral outline of the radio-opaque enamel will be seen. So here is a picture, clinical picture of hypoplastic amelogenesis imperfecta, which is a pitted variety, wherein you can see numerous pits. These pits represents inadequate deposition of the organic matrix. So whatever organic matrix has formed has mineralized nicely. Next, moving on to hypomaturation amelogenesis imperfecta. Here matrix is laid properly, but there is a defect in the maturation of enamel crystal structure. So because of which it results in mottled, opaque, white, brown, yellow discoloration of the teeth. So as it forms a brittle structure, so enamel surface it tends to chip off easily. And radiographically, as maturation is inappropriate, the radio density of enamel will be similar to that of the dentin. So here is a clinical picture of hypomaturation amelogenesis imperfecta, wherein the teeth are mottled in color with opaque white brown color discoloration. So the next type of amelogenesis imperfecta is hypocalcified variety, wherein there is no significant mineralization which can be seen. So the enamel here will be very soft and it will be easily lost, and the occlusal surface will be more irregular because it is soft and easily lost. And radiographically, the radio density of enamel and dentin will be very similar. And if you see the color of the tooth, it will be more like yellow to brown in color. So here is a clinical picture wherein enamel looks yellow to brown in color and most of the occlusal surface is lost in few teeth, and enamel also looks so cheesy. So that is about amelogenesis imperfecta. Now moving on to dentinogenesis imperfecta. So basically it is an autosomal dominant condition which represents disturbance in the dentin formation. So here the tooth will appear grey to yellowish brown in color, and they show tulip shaped crowns. So that means because of why this tulip shape is because of the broad crowns with constriction at the cervical area. So here is a radiographic picture of a dentinogenesis imperfecta where the teeth are showing tulip shape, that is broad crowns are there with constriction at the cervical area. So going on into the classification of dentinogenesis imperfecta, first classification was given by Shields, where he divided this condition into three types, type 1, 2 and 3, where type 1 represents association of this dentinogenesis imperfecta with a systemic condition called osteogenesis imperfecta, and the rest two represent isolated opalescent teeth. But later on this classification has been revised. Why? Because it has been proved that dentinogenesis imperfecta is an isolated condition and it is not associated with any systemic condition like osteogenesis imperfecta. So type 1 of Shields is removed. So what is the revised classification now? There are only two types. So the type 1 of dentinogenesis imperfecta represents dentinogenesis imperfecta without osteogenesis imperfecta, whereas type 2 represents Brandywine isolate. Now we'll see these two types. So dentinogenesis imperfecta 1. So this is also known as opalescent dentin, which is caused by mutation of DSPP gene. DSPP in the sense dentin silophosphoprotein gene, which codes for proteins like dentin phosphoprotein and dentin siloprotein, and this gene is present on chromosome 4. So here the teeth will appear blue gray or amber brown color and shows opalescent nature. So this is a clinical picture of type 1 dentinogenesis imperfecta wherein teeth are blue gray in color with opalescent nature. And this is a radiographic picture of this condition wherein they are tulip shape with a bulbous crown and roots are narrower than normal and completely obliterated roots. Going on to type 2 of dentinogenesis imperfecta, wherein the crowns of the deciduous and permanent teeth wear rapidly after eruption and shows multiple pulpal exposures. Here the dentin is amber and smooth. And if you see radiographic features, the teeth will have larger pulp chambers and root canals with very thin dentin. As you can see in this picture here, it has very large pulp chambers and root canals and very thin dentin is there, resulting in shell teeth appearance. So this appearance is called as shell teeth. So what are all the histological features in this? Because there is a defect in dentin formation, there will be irregular and disoriented dentinal tubules, and the tubules will be of larger in diameter. So these are the histological features. Next, moving on to the next condition in structure of teeth, that is dentin dysplasia. So dentin dysplasia, it is also an autosomal dominant condition which is characterized by atypical dentin formation with abnormal pulpal morphology. So this dentin dysplasia, it is also called as rootless teeth. Rootless teeth. So basically dentin dysplasia is again broadly divided into two types, that is type 1 and type 2. So wherein type 1 is called as radicular dentin dysplasia and type 2 is called as coronal dentin dysplasia. Here we will compare and contrast both radicular and coronal dentin dysplasia in clinical and radiographic features. Going on to radicular dentin dysplasia, here the teeth will appear clinically very normal and the teeth also show normal eruption pattern. But here the teeth will show extreme mobility and are exfoliated prematurely as a result of short roots. Whereas coronal dentin dysplasia, here both the dentitions are affected, wherein the deciduous teeth will have yellow, brown or bluish grey opalescent appearance, whereas permanent teeth are very normal. In radicular dentin dysplasia, the radiographic features will be, as we have discussed in clinical picture, it has short roots, right? So these roots are short, blunt, conical, and the pulp chambers are obliterated completely, as you can see in this picture. W-shaped roots, obliterated root canals and shortened roots. That is why they exfoliate prematurely itself. That is why they are also called rootless teeth. Whereas in coronal DD, the radiographic features will be, in permanent teeth there will be abnormally large pulp chambers in the coronal portion, which results in thistle tube shaped abnormality. So here this radiograph shows thistle tube shaped pulp chambers. Next, going on to main histopathological features of radicular dentin dysplasia. Here usually the coronal dentin will be good. Why? Because this is a defect in radicular dentin. So coronal dentin will be normal, whereas root portion shows normal dentinal tubule appears to be blocked in this, so that the new dentin is formed around the obstacles, that is around the old dentin, showing lava flowing around boulders appearance. Lava flowing around boulders appearance. The next condition is regional odontodysplasia. So here it is a localized non-hereditary developmental abnormality of the teeth with extensive adverse effects on the formation of enamel, dentin and pulp. So all the three layers will be defective here, and it is non-hereditary if you remember. The rest all are hereditary. And under clinical features, here there is a delay or total failure of eruption, and the shape of the tooth is irregular, and there is a defect in mineralization pattern also. So whatever teeth which erupts, right, they will demonstrate small irregular crowns that are yellow to brown and often with a very rough surface. So here is a clinical picture of regional odontodysplasia, wherein the teeth, some teeth, they demonstrate small irregular crowns and they are also yellow to brown in color. And if you see radiographic features, the altered teeth, right, they demonstrate extremely thin enamel and thin dentin surrounding an enlarged radiolucent pulp. So as a thin enamel and thin dentin, so they have this wispy image of the teeth. So because of which these teeth are also called as ghost teeth. So moving on to histopathological features of regional odontodysplasia. Here there will be marked reduction in amount of dentin and widening of the predentin layer and presence of large areas of interglobular dentin and irregular patterns of dentin will be there. Irregular tubular pattern of dentin will be there. And the follicular tissue whichever surrounds the crown, this may be enlarged and typically exhibit focal collections of basophilic enamel-like calcifications called enameloid conglomerate. So the one in this histological picture, that is the circled one, they are all nothing but enameloid conglomerates. So these are the histopathological features of regional odontodysplasia, and this marks the end of developmental disturbances of the teeth. So these are the various developmental disturbances. So understanding their etiology as well as the clinical features, they usually help in arriving at a proper diagnosis of the condition. So when you arrive at a proper diagnosis of the condition, it also helps in achieving a proper treatment plan. So identifying the particular condition is always important in these situations.